Thank you for joining us today. I'm joined by my colleagues, Pat Warren, Chief Safety Officer, Sarah Feinberg, Acting President of New York City Transit, and Mario Peliquin, Chief Operating Officer. The MTA continues to work around the clock to respond to the COVID-19 pandemic. We've led the nation in terms of aggressive response and actions to protect the health and safety of our customers and 71,000 employees. I want to take a moment to update you on some important gains we've made here at the MTA in the last few days. We've seen more than 3,000 employees return to work at this time, up more than 10% in a day. And our cases of quarantine workers are down for a fifth consecutive day to just under 4,900. The MTA workforce are the heroes moving the heroes of this pandemic. They are a part of the New York family, and they have been hit hard. They're not immune to what's going on, but those who are healthy are showing up for work day in and day out and working heroically. Heartbreakingly, this dedication has come at the highest cost. We've lost 59 of our colleagues to COVID-19. Their sacrifices will never be forgotten. Without a doubt, this has been one of the hardest times in MTA history for all of us. To honor their heroic commitment and loss of life and to support their families, we've reached COVID-19 family benefit agreements with the TWU, SMART, and IBT, International Brotherhood of Teamsters Local 108, on how to honor their service. I note that these discussions began between John Samuelson and me several days ago. This is a first-in-the-nation agreement that will protect and provide the families of those we have lost with substantial benefits, befitting the tragic loss they have experienced. These benefits will include a payment of $500,000 from the MTA's operating funds to the surviving family of any worker who lost his or her life due to COVID-19 infection. The family benefit agreements also provide health insurance to the worker's spouse, and where there is no surviving spouse, dependents to the age of 26, in each case for 3 years. We're having ongoing discussions with all our labor partners to extend these benefits to all the MTA's represented employees. And we expect every one of the MTA labor unions to enter into an identical agreement that TWU, Local 100, SMART, and IBT have already done. We're having ongoing discussions, as I mentioned, with all our labor partners to extend these benefits to the MTA's represented employees. And the agreement will be extended as well to all non-represented workers as well. The MTA board is expected to consider and ratify these provisions on April 22nd. The health and safety of our heroic workers is our #1 priority. We've said this since day one, and every action we have taken since then has been in furtherance of that goal. There's been a lot of analysis recently about actions taken. We're still in the middle of the battle for New York, literally, and we will continue to remain laser focused on action to protect New Yorkers, our customers and employees, and not words. There will be time for reflection and evaluation later. Now is not that time. Right now, we are focused on providing necessary service to the other essential personnel and first responders, like doctors, nurses, pharmacists, grocers, and food delivery workers. We continue to take new steps every day to protect employee safety. That's why I'm pleased to announce that we're now partnering with Northwell Health, Go Health, the largest healthcare provider in the state of New York, to give priority testing for symptomatic frontline transit workers at over 50 Northwell facilities throughout the MTA service region. We've reached an agreement in principle today, and additional details will be released shortly. This, I'll note, is in addition to the state's efforts to provide priority testing to frontline workers such as transit workers. Again, the MTA has been at the forefront among public transit agencies nationally in responding to the COVID-19 pandemic. We have taken aggressive action to benefit the pandemic since it arrived in New York, distributing 2.7 million pairs of gloves and nearly 750,000 masks since March 1st. We disregarded guidance on masks from the Centers for Disease Control and the World Health Organization before those organizations eventually changed course to advise that all Americans wear masks. And we began to deploy our nation-leading temperature brigade to test tens of thousands of frontline employees across the system on March 24th. That program has recently been expanded to 22 MTA locations system-wide. I'll note that since the temperature brigade was disclosed, we've received calls from agencies all over the country. The MTA has also implemented rear door boarding on buses to eliminate contact between passengers and bus operators, eliminated cash transactions to prevent person-to-person contact. Plexiglass barriers are being installed at locations across all 28 bus depots to further protect employees. Our stations continue to be disinfected twice daily with our full fleet of rolling stock, more than 8,000 train cars and 5,000 buses, being disinfected every 72 hours or less. Accessoride vehicles are disinfected daily. Thank you, and with that, I'll take questions.
Joining Pat here at MTA headquarters this afternoon, left to right on your screen, it's Pat Warren, the Chief Safety Officer, Sarah Feinberg, the Interim President of New York City Transit, and Mario Pelican, the Chief Operating Officer. With that, we'll go to your questions. First is David Meyer of The Post. David.
Every 72 hours or less. Accessorized vehicles are disinfected daily. Thank you, and with that, I'll take a question.
Joining Pat here at MTA headquarters.
David, your question. We're ready for your question. If you could turn down your monitor, please. Our next question, Michelle Caskey from Business Week. Michelle.
Good afternoon. Thank you for the presser. Can you give us an update at all in terms of finances and what and where things stand now? I know you guys had a disclosure that you made about a couple weeks ago, but how do revenues look?
Well, Michelle, we've been reporting the precipitous declines in ridership. Subway ridership is down between 93 and 95%. Similar percentage declines at Long Island Railroad and Metro North. Bridge and tunnel traffic is down between 2/3 and 69, 70%. So obviously our revenue has declined significantly. We disclosed that obviously in the continuing disclosure that we made, and also in our letter to the congressional delegation. We also expect declines in the dedicated taxes and subsidies, which are approximately half the revenue of the MTA. We were gratified by the work that the congressional delegation did on the first round of CARES funding for transit agencies, where we will have been allocated slightly under $4 billion. We will clearly be going back to the New York congressional delegation. We're very thankful and grateful for their work, and we'll be asking for additional federal funding given the dramatic impact of the pandemic on the New York region and the MTA in particular.
And how much federal funding, how much additional do you anticipate?
Michelle, it'll be substantial, and when we're in a position to disclose it, we will.
Our next question is Roger Stern, 1010 Wins. Roger.
Mr. Foy, for essential workers who are understandably worried, how safe is it to ride New York City buses and subways?
Well, look, Roger, here are the instructions. One is if you don't have to travel and you're not an essential worker, you ought to stay home, one. If you don't feel well, you ought to stay home. Our strong advice is if you're going to travel on subways, buses, Metro North, or Long Island Railroad, you should wear facial protection, a scarf, a mask, a bandana. If you take those protections, you will have done everything you can to minimize your health risk. As I mentioned, we are disinfecting stations and rolling stock and buses. We've been doing that since March 3rd. Started on March 3rd with that disinfecting regime and then ramped it up, the stations twice a day. But those are the advice we would give to every one of our customers at this point.
Our next question is Josh Einiger from Channel 7 Eyewitness News. Josh.
Tim, can you hear me?
Go.
Hey there. So I actually had two questions. The first is regarding the compensation to the families of the fallen employees. And I'm wondering, I know, Pat, you talked about seeking federal funds to assist in operations moving forward, but currently, where is that fund coming from? And I have a second question after that, if you would indulge me that.
So the funds for the family benefit that I described will come from MTA operating funds, and we are in a position to make those payments, and we will work expeditiously to make those payments as promptly as possible.
But in other words, they come at the expense of something else. I mean, presumably those are budgeted for other functions, correct?
Well, look, it's a reality that every family organization in the world, if you spend $1 on something, you can't spend it on something else. The family benefit is given the tragic loss of life, we believe an absolutely appropriate expenditure. I intend to move the matter at the board meeting a week from tomorrow, and I would expect that my colleagues on the board will vote to approve it.
Okay, thank you. And then if you could, with respect to the cleaning of the system, Governor Cuomo today at his briefing talked about, among the considerations to resuming business, some semblance of business as usual, is, I think he said, I don't want to misquote him, but he said basically, how do you clean the subways? And so I guess I'm curious, does that imply that there's more that needs to be done in terms of the cleaning regime to prepare for a larger number of commuters to return to the system? Do you know what he was talking about? Have there been conversations about improvements to that moving forward?
Look, as the pandemic subsides, every part of society, commercial activity, economic development, transportation, and schools will be looked at in a new light. I have put together a team of senior managers here to look at the short-term, intermediate, and long-term needs and things that have to be adjusted and changed. And as we go forward, we'll be speaking more about those changes. And obviously, we're in close contact with the governor and his staff on a not daily basis, but speaking with them many times a day.
And the next question is Dana Rubenstein, Politico. Dana.
Hey, Pat, how would you describe the status of the capital program?
Look, the capital program, Dana, as you know, was approved by the MTA board. It was approved by or deemed approved by the Capital Plan Review Board. As I mentioned a minute ago, every element of life in the United States and frankly beyond has been changed by the pandemic. It would be foolhardy to say that that is also not true of the capital plan. We are intent on maximizing the capital plan. That's one of the reasons why the first round of $4 billion of federal funding was so critical. We'll be making a further ask to the New York congressional delegation, which was so helpful the first time around. But every element of life in the United States has changed, and that is true with respect to the MTA.
Is it fair to assume that congestion pricing is a non-starter?
I don't think that's fair at all. That will be reviewed. We continue to work on central business district tolling.
And the next question is Dan Rivoli, New York One. Dan.
Hi, good afternoon. For the families whose loved ones who are MTA workers died from coronavirus, how soon can you expect them to get the benefit And what is the MTA asking of them in terms of documentation? What are they going to have to prepare and put together in order to get the benefit and not face any administrative or bureaucratic hurdles?
So, Dan, we are focused on processing these claims as expeditiously as possible. Sarah Feinberg, president of New York City Transit, has spoken to every one of the families, and we intend to do everything we can to expedite it from beginning to end.
Is there going to be any requirement to show a certain kind of documentation? Are you asking them anything specific about that?
Dan, the details of the documentation will be worked out. The commitment that we've made to our union partners and our colleagues here is that we will do everything we can to process this expeditiously. We think that's obviously completely appropriate under the circumstances.
I'm going to jump in for one
Please,
second.
Sarah.
It's Sarah. I just wanted to clarify. I've spoken to many of the families, but Craig Cipriano has spoken to many of the families. Sally LeBrer has spoken to many of the families, and there are some families who, for obviously understandable reasons, have not been reachable yet. So I just wanted to clarify that.
Thank you, Sarah.
Next question is Steve Nesson from WNYC. Steve.
Hey there. Hey there. My question is related to Dan's. Will the money come in one lump sum, or will it be stretched out over a period of time? And related to Dan's question, will they have to prove that they contracted COVID-19 at work?
The answer to the first question is a lump sum. And look, I will speak for myself. I was tested positive. I have no idea how or when or under what circumstances I came in contact with the virus. We're not going to require that of our fallen colleagues. Tim?
Next question is David Meyer. We're going to try him again from the Post. David?
Can you hear me okay?
We do.
Okay, perfect. Pat, I'm glad to see that you are healthy. Wondering,
Thank you.
Along the lines of Stephen's question, these aren't literally line of duty deaths. So, and there's been talk of whatever pre-existing health conditions working in the transit system could cause. Is the MTA, in assigning these deaths line of duty distinction, acknowledging that perhaps not the agency, but that the workplace and the job caused these deaths, or have been related to them?
This is not a line of duty benefit program. This is a family benefit program given the tragic loss of life in a horrific pandemic. It's a family benefit program, David, as I described. It's $500,000 to surviving family members. We will process it absolutely as expeditiously as possible, but it is not a line of duty benefit.
So why is the MTA taking this financial burden on itself then?
I'm sorry, what was the question?
Why is the MTA taking on the financial burden of paying out these benefits if it's not a line of duty death? Like where exactly does do you as an MTA executive feel that the agency had the responsibility to pay this?
Look, we believe that under the horrific, unexpected, and extraordinary circumstances of this pandemic, that it is an appropriate thing to do given the loss of life that has occurred. As I mentioned earlier, I intend to move this matter at the board meeting a week from Wednesday. I expect my colleagues on the MTA board to approve it. And I think it is absolutely appropriate and fitting for this family benefit program to be put in place and affected.
We move on to Alfonso Castillo from Newsday. Alfonso is on with you.
Hi, everybody. A couple questions. I apologize if maybe you've touched on this already. One, is there an estimate for what these benefits are going to cost as a whole to the MTA? And secondly, if
So, Alfonso, on that one, we'll be reporting next week at the board meeting.
Okay, and secondly, is a condition of accepting this benefit waiving any potential litigation against the MTA? And if somebody turns it down, does that free them to go ahead and theoretically sue the MTA?
Look, we are not making, we're not putting the family benefit place in effect as a litigation avoidance tactic. We believe it is the right thing to do under the circumstances for those family members of the 59 of our fallen colleagues. And again, we'll be reporting to the board and the public and the media about the cost of the program a week from tomorrow.
Thank you.
All right, we're going back to Roger Stern, has his virtual hand up again. Roger?
I didn't know how to lower it. No, I don't have it up again.
All right, reporter who does not have a question. How about Dana? Your hand is still up?
Yeah,
Yeah, Dana,
can you hear me?
go ahead. Yes, we do.
Okay, I guess this might be a semantic question, but maybe it's not. Why are you insisting it's not a line of duty benefit when the $500,000 is the line of duty benefit that the union has been asking for, and that is, that's the number in their contract agreement for line of duty death?
We and the unions have characterized it as a family benefit, and I believe that's appropriate, and I'll let the union speak for themselves.
All right, Josh Einiger has his hand up again. Josh, something else?
Yeah, just something else. And forgive me, Pat, because I did sign in a little bit late, so you may have touched on this, but so you have 59 MTA colleagues who lost their lives to COVID-19. For any future MTA employees who succumb to the virus, will their families also be eligible for this payout?
For a time period, yes. We're all obviously looking forward to the subsidence of the pandemic.
All right, the last question now is Clayton Gusa, the Daily News. Clayton, you are on the air.
Hey, can you hear me?
We hear you well.
Great. Two questions. First, what's your process right now for bringing workers who have tested positive or exhibited symptoms back to work? Is it 14 days after symptoms? I'm hearing it's 72 days after they've cleared symptoms. And also I've heard some workers gripe that they're having trouble communicating with people about, when they are clear of the symptoms. Today, one bus operator told me that he was given a fax number to send when he was clear of symptoms, but he doesn't own a fax machine. So can you walk me through that process and how you guys are handling that?
Yeah, hi, this is Pat Warren. So the answer is that the state has put out, the state health department has put out a guidance on this. The guidance is that any individual who's been, has gone at least 7 days with the virus and then is 72 hours fever-free without the use of a fever-reducing medicine is eligible to come back. In our organization, in MTA, though, that we are looking at the full 14 days as a general rule, would have to be extraordinary for us to bring them back earlier. And the same thing applies, is that they have to be fever-free for 72 hours without the use of a fever-reducing medicine. That said, the guidance is that they do not require a retest. They do not necessarily require a information or a letter from their doctor or their healthcare provider saying that they can return to work. That said, it is very helpful if we do have that information in terms of just being able to process their leaves and other bureaucratic information.
Just a note from Transit's perspective, we are seeing improvement in our numbers on this front. So we have gone from most recent numbers from 4,826 quarantined to 3,660. So our numbers and I watch them multiple times, not just every day, but multiple times a day, click downwards, and they've been doing that for a couple of days now, which is great news. And in terms of return to work, we have now returned 2,020 folks who were previously out to work. So those are the numbers who have come back and returned to work healthy. So those are improvements.
Great. And one other, is, Pat, last month you said that the Transformation Office had effectively reduced all of its activities surrounding reduction in force. Last week, Mr. McCord put out a video online that said, hey, we're going to emerge as a new MTA at the end of this. What does that mean to you? What is that office working on specifically now?
I think Anthony's was speaking for the entire organization, which is we will get through this pandemic. New York and the United States will get through this pandemic, and we intend to help our role in restoring New York City and the regional economy. That's what the MTA does, and we look forward, once the pandemic subsides, to taking on that challenge. Thanks.
Thank you, everybody. Thanks so much.